Hello, your health is in your hands, channel subscribers. Good evening, and how are you? Hope you guys are doing very well. And today I would like to present one important study, particularly for the girls and ladies. And there is a study conducted in Australian Bond University and published in the European Urology Focus Journal. What they are trying to say, cranberry juice can help to prevent the urinary tract infections, particularly in the women. So, friends, 50% of women will have at least one episode of urinary tract infection each year. Particularly in adult women, the chances of getting urinary tract infections are really, really high. And major reasons are the microorganisms, bacteria, and fungus, and then other reasons. So the problem is because the people are using antibiotics very frequently and the left and right without doctor prescription. So there is an increasing prevalence of antimicrobial resistance has been registered. So because of this, if you don't try to reduce the unnecessary usage of antibiotics over a period of time, these bacteria or microbes will develop the resistance against antibiotics. Then no person or no disease will respond to antibiotics, and then this is going to be very threatening condition. So that is where the research scientists from the Bond University, from the University of Helsinki, from the University of Oxford, they tried to find the evidence for the non-drug interventions. So in the process, they found that cranberry juice can help prevent the urinary tract infections, particularly in women. There are total 18 randomized controlled trials they have taken. In this study, what they understood in the people where they have used the cranberry juice compared to placebo means they could have given water also. There is almost a 27% lower rate of urinary tract infections has been found. In another group, they have taken another two groups. In one group, they have given cranberry juice. In another group, they have given no treatment. In that group, they found that almost a 54% lower rate of urinary tract infections. You can ask me, what is the difference between this no treatment group in the placebo group? Friends, when they are doing the clinical trials, they will take the two groups and they will only tell to the people, we are giving drugs. They don't say that we are giving placebo. So when you are giving even water also saying that we are giving some remedy to you, the psychological feeling itself will help and reduce the disease burden. So here, if you see, compared to a group with placebo, compared to a group with no treatment, in the group with no treatment, the lower rate of urinary tract infections is almost 54%, whereas in other group is only 27%. And then another 8 meta-analysis study, they try to understand what is the requirement of antibiotics. They have taken two groups. In one group, they have given cranberry juice. In another group, they have given placebo. In the group where they have given cranberry juice, there is lower requirement, almost 49% lower requirement for antibiotics. And they have taken another two groups. In one group, they have given cranberry juice. In another group, they have not given any treatment. In this, where cranberry juice is given, almost 59% lower requirement of antibiotics has been found. So this is a clear evidence that cranberry juice can help to prevent the urinary tract infections, particularly in women. So the best idea, there are more women who get the urinary tract infections. Urinary tract infections means where they go for the pee, they will have white discharge, they will have irritation, they will have a burning sensation, and they will during urination they feel pain and all these things. This happens because if the microbes, bacteria, if the bacteria is more than 1 lakh CFU per ml, that is where they develop these urinary tract infections. Now you can ask me why cranberry can help to prevent the urinary tract infections, particularly in women. Cranberry will have a compounds like malic acid, citric acid, and then fructose, glucose kind of ingredients. What they do, they will not allow this bacteria to stick to the wall of urinary tract. They will not allow this bacteria. When they don't allow the bacteria to sit on the urinary tract, obviously bacterial multiplication will not take place. So the infection rate will come down. So friends, particularly you might have female in your home, maybe your mother, your sister, your grandmother. They may have, maybe your wife, they may have urinary tract infections. the best remedy to reduce the urinary tract infections is to use the cranberry juice. This is cranberry juice, and you can ask me how much is required. There is one study what it says that 450 ml of cranberry juice per day for 3 weeks could able to reduce the urinary tract infections in almost 50% of women. So almost 450 ml of cranberry juice can help significantly in 3 weeks of time. This cranberry juice can help to prevent the urinary tract infections, and even if the people are already suffering with urinary tract infections, it will help to reduce the symptoms and reduce the intensity also. So requirement for usage of antibiotics would be very, very less, and cranberry juice usage is very, very economical also. If you like this information, please subscribe our channel, share it and comment it. Thank you very much.